Okay. Good morning still, everybody. Welcome to the Auditor's Desk. Thank you all for coming. Just a quick show of hands, how many of you attended the Auditor's Desk last year? Okay, a few. So first of all, you folks will know how inspiring that was last year and what a wonderful success and great idea it was and how jazzed everybody was leaving the room by it. At the risk of repeating myself, I'll just quickly explain what we do. This is, for all intents and purposes, Dragon's Den, but we couldn't afford the trademark licensing, so it's the Auditor's Desk. The process is simple. 4 teams or 4 individuals are going to come and present their idea about increasing access to physiotherapy to our auditors / dragons. Our auditors are going to ask some questions and then assess the merits of each of these ideas. Today we're awarding 2 prizes. First prize is $2,000 contributed by the foundation, the Physiotherapy Foundation of Canada, which, by the way, hopefully you've all received a donation card. So the foundation that wants to drive that research and innovation to generate good ideas to increase access to physiotherapy. Second prize is $500, very generously donated by Pure Care. And we'd like to thank Barry from Pure Care. Unfortunately, he was going to be one of our auditors, but he had to get back home due to, I believe, a family issue. And so 2 prizes. Basically, the rules are, I'm not going to introduce the presenters. They're going to have to introduce themselves or at least get the auditor's attention and have them like them already. So I'm not going to bias that process at all. This is unlike our debate yesterday. This is not audience participation clapping. These folks are the ones who are going to make the decision. So without further ado, I will introduce briefly our auditors so we can get right at it. On the far side, Daryl from Patterson, Diana, who you all know, Doug, who you all know, and Doug's other brother, Daryl, who you all know. We're dating ourselves. Anybody who laughed is of a certain age. All the young people are going, huh? All right, so without further ado, let's have our first contestants. So we have Maggie Bergeron and Ellie Afif are going to come and make their pitch. Come on up.
Hi, I'm Maggie. I'm the co-founder of HealthSwap, an online platform that is innovating the delivery of home rehabilitation programs. Change that. I'm a registered physiotherapist, and since graduating from McMaster in 2009, I have worked in private orthopedic practice. I believe that providing a home exercise program is an important part of rehab, and that my sessions with my patients are really just the tip of the iceberg. The hard work starts at home. Throughout my career, however, I have struggled with helping patients to be compliant with their home programs. I'm also a water polo player, and recently I sustained a concussion and a whiplash injury. Being a physiotherapist, I knew exactly what I needed, physiotherapy. So I started to see a physiotherapist, and she provided me with a home exercise program. Due to my concussion, I had some difficulty remembering my exercises. She would send me emails, but these were difficult to find in my inbox, and sometimes she would give me paper handouts, but these were easily lost. So I started to become just like my patients. I was struggling to do my homework that was given to me by my well-intentioned physiotherapist. Fortunately, around the same time that I was recovering, I joined a Dragon Boat team and met Ellie, the other co-founder of HealthSwap. He was an engineer who was leading software development at a company developing apps for hospitals. We started to discuss my frustrations as both a practitioner and a patient, and after much research, we found that my situation was not unique, and that in fact, 50 to 70% of patients don't do their exercises as prescribed. A large part of the problem is the way that we as physiotherapists communicate with our patients. So we started to build out a solution, HealthSwap, and we incorporated in 2014. HealthSwap has 2 main components. It's a web portal for healthcare practitioners and a smartphone app for patients. Through the web portal, physiotherapists can quickly provide and track personalized video and education-based home programs. And the platform enables sharing and collaboration between practitioners within a clinic as well as within the entire HealthSwap community. Practitioners can easily upload their own exercise videos as well as articles branded with their own material, and they can monetize on adding value within the HealthSwap community. Patients download HealthSwap via the Google Play and the Apple Store. Patients can then access, track, and view their personalized home rehab program, including exercise videos and educational articles sent to them by their physiotherapist. Patients can record their symptom levels and message their practitioner as needed. So Ellie's passed each of you a device, which you can now view. And on our presentation, the audience will be able to see what you're also seeing. So on here, you're going to see the home screen, which is what the patient sees as soon as they log into HealthSwap. Immediately, you'll see that you've all been doing very well with your home exercise program. And you'll see that you can view the exercises for today, any messages that you may have, and the handouts that are available. You're going to click on the green button for the exercises. Here you'll see an overview of the exercises that are scheduled for today, and the green check marks indicate that you've already done the exercise. You're going to click on mid-back rolling. Here you'll see a video of the exercise. We're not going to watch that right now, but if you'd like to at the end, you most certainly can. And when you scroll down to the bottom, you can see that you can track, if you've done it or not, what your symptom level is, and you can write in any additional notes that you'd like to make about the exercise. Going back, you're going to go back to the main screen for the exercises. If you already know the exercise that you're meant to do and you understand it well, you can simply just swipe left, and you can also track if you've done the exercise or not and your symptom level. You're going to go back to the main screen again, and here we're going to click into the handout section. From here, you'll see an overview of the handouts that your practitioner has sent you, and you're going to click on the guidelines for ball rolling. Here you can read a handout that your practitioner has sent you that just gives some guidelines around how you should do some ball rolling and the rules around that. You can turn off your device now, and I'm just going to quickly go over what a practitioner sees on the HealthSwap web portal. So for a practitioner, it's quite different. There's much more functionality. They have access to a whole library of video exercises as well as educational material. And on the main dashboard, you'll see that there's activities that you're meant to complete as a practitioner, including filling out your bio and your clinic information so that your practitioner knows where to get a hold of you and a little bit more about you. In here is the exercise library, which is a complete library of video exercises that either we've recorded as the HealthSwap team or other practitioners has uploaded in terms of what their specialty may be. You can view any of these, so you have the option to view the video, or you can prescribe it to your patient and add it to a program that you may have already created for your patient, or you could create a new patient from this page. In the handouts library, it's very similar. So you're going to see a library of handouts that have either been uploaded by the HealthSwap team or by other practitioners, including Dr. Baram Jam, Kim Vopni as well. And at the bottom of the handouts library, there's an easy portal which you can click on, create your own handout, and either put it just on your web portal so it's private, or you can share it within the HealthSwap community. Adding a patient is very simple. It's within the Patients tab. You'll see all the patients that you've already added in here. You can buy tokens to add more patients in. Each token is $10 per patient. And from there, your patient will receive their subscription code, and they can join the HealthSwap network. It's free for practitioners to use, and this is based around the idea that all patients should be the owner of their own data, and therefore they are the ones that should be paying for the platform. So again, this is free for practitioners, and it's a $10 fee for a lifetime membership for each patient. So again, HealthSwap is an online web portal for practitioners and a smartphone app for patients. And thank you for listening. We invite any questions at this time. Yep.
Okay, so great job. I just want to ask about privacy. So tell me about national privacy legislation, international, how far does this go, and what have you done with that?
Right, so this is completely PIPEDA, HIPAA compliant. We've ensured that it follows all guidelines. We have our own server, which just means that everything is kept within our server. It's not shared publicly.
With regards to the information that's shared in the HealthSwap community, is that information vetted through any one person, or to ensure that it's current and evidence-based?
Right. So no, it's not actually vetted by anybody. We don't make the decision whether it's evidence-based or not. And the reason is there's been a program in the past that's been created that was created to be evidence-based. But what happened with the program was that there was so much discussion around whether or not something was evidence-based, and there was lots of back and forth in terms of how you actually go through and decide what is. So that program actually failed, and it's pretty close to its inception, so we decided not to go that route. Instead, in our terms and conditions and our privacy policy, it states that we are not responsible for what you prescribe to your patient. So it's just similar to your clinical sessions. Each physiotherapist should be responsible for what they provide to their patient, and they should be using something that's evidence-based or that they are very comfortable with.
Great job. But just question around the cost, right? So when you did the decision to go to being free for physios, and then a $10 lifetime token, and, based on their episode, the challenge is that physios don't have the ethical retailing side of things is always a challenge. So how do you envision sort of that process where I'm going to typically have previously given a home exercise program that was free or give them links to something, whereas now I got to say to them, I'm going to give you your home program, but it's going to cost you $10 for a token. How is it, most clinicians will kind of stand back by that, because most clinicians won't even charge $5 for a TheraBand, and now you've increased rate to 10. Right.
So there's a few different ways that we envision this. The way that we've moved forward with this so far is that insurance companies will actually cover the cost for patients. It's a $10 fee. It's similar to a TheraBand, and we've had great success, and we are talking with many insurance companies around this. Many insurance companies are also creating programs where they're interested in how their patients are doing, from fitness trackers to something like a platform like this, where they can actually ensure that the patient is doing what they're meant to do. So they're quite interested in knowing how well a patient is doing. The other option is that the practitioner can absorb the cost as a business expense, just like paying a monthly subscription to maybe another exercise program that they're already using. So instead of charging the patient, they can absorb the cost. Also, the more patient tokens that a practitioner buys, the less it costs. And like I mentioned, as a practitioner uploads more information onto the HealthSwap network, we actually reward them. So it's a bit of a revenue sharing between us and practitioners to create an excellent broad library of exercises that shares many different features of physiotherapy and many different specialties.
Have you done a full financial viability plan to look at, at $10 per token, for example, how long you can sustain this, and more importantly, will it support future updates?
Yeah, so we have looked at this. We actually have a few advisors on our HealthSwap team who advise us for business purposes. The $10 fee will sustain us through several years, and as the network grows, we're going to be able to add on other features that will create either advertising opportunities on the HealthSwap network, where we can sell advertising space for things like courses or a congress that's coming up, and our revenue stream will go in many different directions that way. So the $10 per patient is really meant as a way to provide access to a technologically feasible way for patients to view their exercises to start, and then from there our revenue model will shift.
Collect the hardware. That puts the business model in the hole for a second. Perfect. All right, so thank you, Ellie and Maggie. Very well done. Just a clarification, by the way, I forgot to mention that PureCare is donating either a treatment table or 4-channel IFC unit to the winner, and that the $500 prize is actually donated by the private practice division, which is very generous. So Maggie and Ellie will be outside the room. They'll stick around, and we'll bring in our next individual, Lacey Nairn-Peterson. Come on up, Lacey.
Greetings, auditors, and everyone else who has joined us here today. Thank you for this opportunity. Our proposal is titled The Lighthouse Project, Enhancing Access to Community-Based Physiotherapy. I'm presenting on behalf of other individuals listed on my first slide here. First of all, I just wanted to point out the irony of a farm girl from Saskatchewan traveling all the way to Nova Scotia to tell about a lighthouse. Let's consider for a moment what a lighthouse symbolizes. It stands as a point of reference and stability, helps navigate through difficult times or stormy seas. It provides a sense of hope and comfort for nearing the end of a journey. Let's hold those thoughts with us as I tell you more about our lighthouse. This is the lighthouse in Saskatoon. It provides emergency shelter, supported living, affordable housing to those in need. It also provides employment counseling, addictions counseling, recreational activities, mobile outreach, a nurse practitioner, and an EMS on site. Individuals using the services at the lighthouse are those that do have reduced access to healthcare services, despite being positioned in a downtown core area. Populations such as First Nations have been shown to access healthcare services later within their disease course. Also, individuals who are homeless have been shown to have self-reported conditions such as head injuries, back problems, pain, arthritis, all that are treatable with physical therapy. There is an inequity currently between those that require the services and the availability of those services. Within the past year, paramedics have been called to the lighthouse almost 400 times, resulting in many emergency department visits. Less than 10% of those individuals were actually admitted to the hospital, so leading us to believe that enhanced access to community services would be an asset for those individuals there. A paramedic actually stationed at the lighthouse was part of that initiative. So in December 2014, the executive director and nurse practitioner from the lighthouse identified the need for physical therapy there. The Sask Physio Association linked up the lighthouse with the CBI Health Group. So they were so generous and offered pro bono support for a therapist there for a pilot project. Two stories showcase the diverse impact that PTs have had so far. One therapist was able to help a lady with urinary incontinence at the lighthouse. The physio was able to problem solve with this lady and assist with bladder retraining. The incontinence was a barrier for this lady to obtain employment and have confidence to be social and integrate back into society. The physio helped her through this. Another therapist encountered an individual with cystic fibrosis. The therapist helped him problem solve through secretion clearance techniques and was able to link him up with the cystic fibrosis clinic. So resources were available, but the client just needed to know where and how to access them. The therapists that have been working at the lighthouse have used a variety of their skills and have been energized by the experiences that they have had so far. Here's a few more details of our project. So the pro bono support from the CBI Health Group has really enhanced the feasibility of the project. Also, the school and faculty at the School of Physical Therapy has been involved in helping to develop an evaluation framework. And also the collection of data so far. The proposed use of the Auditor's Desk funding is for a Master's of Public Health student to complete a program evaluation. A 3-month practicum is part of their program requirements, and an honorarium $2,000 would be supplied for their part in evaluating the pilot project. Overall, this project aims to deliver services to those in need who may not have had access to physio under previous circumstances. Also, it hopes to provide evidence for inclusion of physio within primary healthcare teams. Physios are not yet involved within primary healthcare teams within Saskatchewan. It's a role that has been also under development throughout Canada as well. Also, there is the opportunity for change within Saskatchewan right now. There's currently an initiative ongoing that focuses on patient flow throughout the system. So incorporating that physio into the community would be an innovative idea to hopefully prevent that emergency department visit in the first place. The auditor's desk asked for simple yet highly impactful solutions for bringing physio to people in the community who need it. This project doesn't need any specific technology or specialized skills. It's as simple as the physios being in the right place to serve those who need it. In closing, let's think back to the picture of the lighthouse and the symbolism it holds. The Lighthouse Supported Living stands as a point of reference for those in the downtown core of Saskatoon and helps them navigate through difficult times, giving hope and stability. The physios working there have had an impact so far on the individuals the Lighthouse serves, and we hope for the continued opportunity to be part of that community. Thanks.
Thank you, great job. Out of the 400 times that there were unnecessary emergency department visits from the Lighthouse project, have you quantified how many of those would benefit from this particular project?
We didn't look specifically at the reasons for the emergency department visits. That was one thing we were going to look at over time too, to see now that there is physio there, then look at the emergency department visits to see if there was a decrease. So I guess to be determined to a certain extent, but yes.
So I'm wondering, you were talking about provincial health ministry priorities.
Yeah.
So what you're trying to do is to show them that this is the right model, right?
Yes.
Have you spoken to them? What talks have you had? What are they looking for, and when do you anticipate linking with them again?
I am part of the initiative that is ongoing. I do work in the emergency department at the hospital that I work with also. So I have been within the team that's working on more of the emergency department specifically, but do know who to contact to have more talks about that upstream or the community part of it as well. I'm a member of the Sask Phys Association board as well, so another board member is working on more of that community access to physio as well, so she's working more on that committee, so we do have contacts with them. We don't have a timeline specifically. The therapist support goes until August, so after that we'll see where we're at and how to present further.
Thanks, Lucy. That's the trouble with going after DHR. She takes all the good thoughts. I had that as a thought. I personally like the idea of collaborating with SPA on this, Saskatchewan Physiotherapy Association, and the branches. The funding that's being used for the master's student, is there a value to that, or the cost to that? Do you have that information?
Like the cost for the honorarium for them?
Yes.
There's not a specific cost for the honorarium for the student. From what I understand, there's a lot. There's a lot of different projects for the students to select from, and there's not always a specific honorarium that's linked to it. So some may not have an honorarium linked to the project, and some may. So it would be an asset, I guess, to have an honorarium linked to our project that we're looking for help on.
Is it 3-month paid practicum?
Not paid. No.
This is great. So just my thoughts too to Daryl's question is we could have helped all 400, right? So looking at this, the only concern I have is obviously, financial sustainability, right? Even if you get a grant, where's it going to go?
Yeah.
So I guess the question I have for you is, are the program evaluation that's going to happen with the master's student that would be coming through, what are you guys expecting to look from that? So with the $2,000 student comes through,
Yeah.
what are you predicting? Are you looking to basically change sort of primary care to the level of being able to evaluate each of those to say how much money that ER visit prevented would save? Is that the intention?
Yeah, so the evaluation would be, we would look at, sort of the patient outcomes, first of all. So to prove that we did have an impact there. They were going to use like the patient-specific functional scale just to look and see if there was an impact with the physio services there. And then we're also doing interviews with the patients after the physio sees them, just to see, like subjectively, what type of impact we've had on them. So I guess that's what we're looking at, what measures we're looking at to see if there is an impact. And then we can link further with the Health Region 2 to see what the number of emergency visits were, or if there's any difference with that. Does that answer your question?
Yeah, I think that stuff's great. I think just the key thing that I'm wondering too is how tying into that economic value of putting a physio in that role, so that you know, when you look at the sustainability of this, all of a sudden you're going, okay, putting this individual in that role, we will now fund that because we know on the back end of it would save this kind of money. So that's just one of the things that I would say is that would be one of my key pieces for what you guys would evaluate with that business student.
And we have looked at within the emergency department how many, if a physio station there can prevent 10 admissions, how much then that would translate to cost effectiveness or savings as well. And we've been exploring that too as well within my job.
Excellent. Thank you very much, Lacey. All right, we're off to a great start. I can see the judges grinding away already. Our next presenter is Jovana Smoljanik.
All right, so good afternoon, auditors. Like they said, my name's Jovana, and today I will be presenting you with an idea that will ensure patients have better access to physiotherapy services and thus expansion of the physiotherapy market. So before I begin, I would like to give you a bit of a background story. And so while I was on my clinical placement in a small town just over an hour outside of Ottawa, one of my patients' husband was having bypass surgery done in Ottawa. Which meant that they would have to drive to Ottawa for preoperative teachings and sessions, and post-surgery, since there was no community cardiac rehab program in their area, this meant that they would have to commute again to have access to these services. At the time, neither of them were in the best of health, and this was a large inconvenience and stressor for both my patient and her husband. Their situation made me think about how physiotherapy services could be made more accessible to Canadians irrespective of their geographical location, and this resulted in the Rehab Zone app. So the Rehab Zone app is a web-based app accessible through your computer or mobile device. And this would allow physiotherapists and potentially other healthcare providers to provide resources to their patients, including videos, interactive games and programming, information booklets, picture explanations, as well as clinicians could upload their own information that they would want to provide to their patients, so it would allow for customization. And as well, there would be real-time outcome measures available. And then the patients would have access to the resource specific to them by accessing the app using their login information. So depending on the type of task, so whether if it was more movement oriented, like an exercise, or maybe a respiratory task like inspiratory muscle training, Rehab Zone would have an integration system with tools already designed to measure patients' performance and participation in this. So for example, if it was a movement task, the patient would be monitored using an Xbox Connect, motion capture software, which would integrate into the app and be able to provide real-time outcomes for the clinician to evaluate patient performance and participation. So what kind of resources would be available on this app? So it would include everything from pre and post-op teaching to cardiorespiratory care things like inspiratory muscle trainers, acquired brain injury and spinal cord injury programs, such as exercise programs and transfer techniques, resources for seniors, such as fall prevention programs, amputation and prosthetic care and rehab, pediatric rehab resources such as interactive games, and many other resources. So our outcome measures would include real-time measurements that are provided back to the clinician, so data from the Xbox Connect. There's also inspiratory muscle trainers that you can hook up to your computer that can give you real-time data, and you can kind of merge the two. And again, the clinician would get feedback on that. Physios would also be able to view if their patients opened and viewed the resources that they had provided for them. That's another way that they could track it. Also, there would be subjective outcome measures, so including RP scales, quality of life measures that the patients would be able to complete. Satisfaction surveys would be also provided to the patients as well as clinicians, so that we could improve this app as we go along and further develop it. And we would evaluate the cost benefit of it, so to ensure that patients are getting better in a cost-effective manner for the healthcare system. So initially, our main target market will consist of physiotherapists working in family healthcare teams, physiotherapists in outpatient MSK, cardio, resp, and neuro rehab, patients, ensuring that patients know that this is available to them and that they can access it, and also companies to make sure that they know that they can advertise their equipment or whatever a patient would need on this app. And in the future, we'd like to get family doctors, surgeons on board, and also target hospitals and get them on board with this as well. So in terms of finances, I've provided you guys with a bit of a summary, but just to give a quick highlight reel. So patients would pay $25 per month for a subscription, plus any equipment that they may need. So like a Connect comes at $159. Service providers, so the clinicians, would have an initial startup cost and training fee of $700, and they would annually renew for $150. And what they would get back is $15 per month for each patient on their caseload. So that's how they can make their money back. Advertisers would advertise for $200 a year. And as you can see by the sheet that I have provided you with, based on very conservative projections, we are expecting to generate a profit of just over $22,000 in the first year and just over $2,940 in the second year. And you can see all the projections there. Now, to cover the prototyping for this app, it would require a cost of $40,000 of investment, and our plan would be to repay it in 2 years, as well as a 5% of all the annual earnings would go to the investor as well. So thank you for your time, and I'm happy to answer any questions.
Thank you. Two very quick questions. First, is it bilingual? Is it available in
Initially it's English, but that could be made a possibility.
Okay, thank you.
For sure, yeah.
Yeah, secondly, I was maybe a little confused. Are patients going to be initially instructed one-on-one in some of the exercises? And if not, how are we ensuring safety through proper technique?
Yes, so initially they would be. So there would be an initial assessment, and so when they initially come to rehab or are getting discharged would be the plan, so that the physio discharging them kind of assesses them, or the physio getting them in rehab assesses them, following which they would know this patient kind of can't come in, and the cost of them coming in is greater than the cost of them would be to kind of have this app and do it on their own. And they know that the capacity of the patient is good enough to kind of follow through with these things. So you would have to ensure certain things, of course, to ensure safety down the line, but for sure an assessment, and then you would be able to monitor progress. And if at any point you kind of saw a fall off in progress, you could kind of get in touch with the patient and make sure that they come back in so that you can get more hands-on and see what's actually going on. So you would have a point of communication with the patient as well.
Thank you. I just wanted to look at partners. Are you the sole owner director and developer of this project?
Yes, and I would have someone also consulting on the software side of things in terms of the development.
Do you have that consultant linked in
Yes.
at this point?
Yes.
And what is their background?
IT, design
background.
and stuff, yeah.
Okay. And do you have a prototype?
No, I don't currently have one.
Okay, great.
So we are developing it.
Great.
So it's in the development, sorry.
Hi, great job. In our country of socialized healthcare, it's almost impossible to get anybody to spend $10 on a piece of TheraBand. So to have patients pay $25 a month plus a Connect system for $159. Have you done any research with third-party providers such as insurance companies as to the viability of them covering the patient costs as they
Right.
do when they physically go and see a physiotherapist?
Yeah. So that's something that would definitely have to be more looked into, and we'd have to look at if insurance companies would count this as physiotherapy services, because they are in a way. So we would have to, that's something we would definitely have to look at and make sure that insurance companies would be on board. But also for some of these patients, it's just so inconvenient that having something at home would be way more convenient and efficient than having to go somewhere. Yeah.
Doug stole my question, which was, but I just one comment. I think it should be, advertising on a program like that at, $200 per year is going to be difficult for sustainability. So I'm looking at one of the things that I would want to see is some sort of value on a click, right? So especially when you're thinking about this more, this app, because the challenges is obviously as you start to evolve this and develop over time, there's going to be annual costs and updates and
Of course.
and more development time that's needed. So there's going to be revenue coming from somewhere. Because I would agree with my partner there is that $25 plus $159 is going to be really, really difficult. I think though is how do you, and I just want to kind of touch upon Doug's piece a little bit further, is how are you going to ensure though that patients will still come see a physiotherapist for their assessment before they make that decision to just come? Because right now I'm assuming I could just buy this app online.
No, they would have to, in order to have access to it, the physio would have to provide them with the login information. So it would be the physiotherapist who's the service provider of this app. They would be the one providing the login information for their profile, for their specific account, so that everything is customized to that patient. Okay. So it wouldn't be like you go online and get this and you get any random program. It would be very tailored to the needs of the specific person.
And then how would you, as the developer, police that so it is always a physiotherapist assessment to guide?
Kind of license numbers. So license numbers, and then they have a certain amount of codes that they can give out.
I just had another question to ask you here. I'm looking at the numbers, and I don't see any attrition or accounting for loss, which is a bit concerning. So if you start with the number of new service providers, how many new ones the next year, how many you're going to retain, it looks to be 100%, 100%, 100% retention.
I just based it on that model for kind of fluidity purposes more than what's actually going to happen in reality. But for sure, we expect losses that someone won't subscribe the next year, around 10-15%.
So there are projections for things like attrition,
that.
And there are projections for
I just
debt accountability and so on. So throw those in.
Yeah, sorry. I just try to make it simple. All right. Thank you.
Okay, thank you, Yervana. So our final contestant is Stephanie Nixon. It's not going to catch on fire, is it? No. Okay, good. Stephanie? Oh, here she comes. Good.
auditors, and honored guests. Here's a story about access to physiotherapy. Chanda is a 28-year-old Zambian woman. She's happily married, she has 2 children, and she's HIV positive. Here's what Chanda told me. She said, HIV is not a death sentence. I have HIV treatment now. I'm going to live a long life. This isn't the end. This is the beginning. This is the beginning of my life. But can you help me with this persistent back pain? And can you help my HIV positive son Moses learn to walk better? And Chanda's right. With drug therapy, HIV positive women, men, and children can expect to live long lives. But with ongoing and diverse forms of HIV-related disability that are going to limit function, well-being, and social participation. And this is because HIV disease affects every body system, resulting in a diverse and far-reaching range of cardiorespiratory, neurological, and orthopedic impairments. And this is precisely what the field of physiotherapy is designed to address. This movement, physiotherapy for people living with HIV, is well established in Canada. But 70% of all people living with HIV and 90% of all children living with HIV are in sub-Saharan Africa, where there is little to no awareness of the role of rehabilitation in the context of HIV, and therefore little advocacy for improving access to physiotherapy. The first step in addressing this gap is educating the physiotherapists themselves in sub-Saharan Africa regarding their role in HIV care. But the problem is this: how to do this essential education in the absence of tailored information. The solution is this new teaching tool, the e-module, titled How Rehabilitation Can Help People Living with HIV in Sub-Saharan Africa, an evidence-informed tool for rehab providers. And I invite you to look at it right now. It's an open access online tool at ssa.hivandrehab.ca. SSA for Sub-Saharan Africa, ssa.hivandrehab.ca. Look around, find your favorite page, and please tweet it out. The first 2 sections are an overview. The 3rd section is all about rehabilitation for adults living with HIV. The 4th section is the most comprehensive compendium in the world of guidance and evidence on pediatric rehabilitation for HIV. And the 5th section is about outcome measures. So here's why it matters. The e-module is an innovative educational tool for physiotherapists in sub-Saharan Africa that demonstrates how rehabilitation can improve the well-being, productivity, and quality of life of the 22 million adults and 3 million children living with HIV in the region. That's a potential impact on 25 million people, which is the equivalent of nearly the entire population of Canada. The target audience for this e-module is physiotherapists in sub-Saharan Africa, and here's how the auditor's $2,000 will be used. These funds will support the first 3 dissemination workshops ever of the e-module in the African countries of Zambia, Kenya, and South Africa. Each of these HIV training workshops will target 25 or more physiotherapy students or PTs already in practice. And what's our business model? 4 points. First, we know that we can run 3 dissemination workshops for $2,000 because we've just done it. We ran workshops in Kenya, South Africa, and Zambia as part of the development of this e-module. Second, we know that the e-module is acceptable to the target audience because it was co-written with 20 African experts and then pilot tested in Kenya and in Zambia with 60 practicing PTs and OTs. Third, we know there's willingness to use this tool because I spent the past winter visiting physiotherapy faculties in key universities throughout Africa to discuss their enthusiasm for rolling out the e-module. And lastly, we've adapted this e-module for use online with iDevices, on mobile devices, and in the absence of internet, that it works very well on paper. So the e-module is ready for dissemination. Who is our team, and why should the auditors trust us with your investment? It's going to take 5 of us to make this project work. And I bring you greetings on behalf of the other 4. One is the Executive Director of the Canadian Working Group on HIV and Rehabilitation, Tammy Yates, who's been at this meeting. This group co-created the e-module and hosts the e-module on their website. The other 3 partners are the leading HIV physiotherapists in Zambia, Kenya, and South Africa who will co-lead these workshops. Each of these individuals was involved in the design of this e-module, and each of these individuals lives in a part of Africa where the prevalence of HIV is greater than 15%. In their communities, more than 15% of the people are living with HIV. These are people who live and breathe the HIV pandemic. They are also among the leading physiotherapists on the continent, and they know very well the gap that's not being filled. Conveniently, our Zambian partner is Dr. Esther Nkandu, who also happens to be the brand new regional rep for Africa for the WCPT, so that will also assist with scale up. So the tool is ready, so is the team. It's just time to roll out the first 3 workshops. But there's one more way that the Auditor's Desk investment will be a springboard for enhanced access to physiotherapy. As leverage. We've had confirmation from the International Center for Disability and Rehabilitation that they will match any initial investment by the Auditor's Desk. Furthermore, we're in active discussions with Grand Challenges Canada, who funded the initial development of this e-module and who are now considering a $500,000 investment in scale-up across the continent, provided we can show that we have new funders at the table, no matter how small. So while $2,000 may seem humble in comparison to our plans, it represents the first new investment, which we hope will launch a very happy domino effect. And so in closing, with the auditor's $2,000 investment, we intend to kick off not just 3 dissemination workshops, but a paradigm shift in the way that the world thinks about the role of physiotherapy in the care of Chanda, her son Moses, and the other 25 million people living with HIV in Africa. Thank you.
Good job at pulling at those heartstrings.
Yeah,
I'm there with you. Let me ask you a question. It's a hard question. Would a $500 beginning send off that same domino effect?
Listen, we'll take what we can get, but 2,000 does feel like the floor, and it's because we'd like to launch this in 3 countries. So we know that we can do that for 2,000. Guess what we can do for 4,000, 6,000, or 8,000, everyone else who has money. But we are thinking about the $2,000 floor was actually a very useful way to start our thinking about what's the bare minimum to get going. Mm-hmm.
Thanks very much. Just to lead on that, you mentioned, guess what you could do with 2,000, 4,000, 8,000, 6,000, whatnot. Have you quantified that at all to see exactly what you could do with that? You mentioned that there's a potential for a $500,000 investment by a certain group. Do you know exactly what that $500,000 will do? Will it potentially help, 50% of the population in sub-Saharan Africa with HIV, or do you have any numbers behind that at this point?
What I can tell you is that Grand Challenges Canada, who is the funder that we're in discussions with, what they're interested in is ensuring that we're able to establish impact on patient health outcomes. So the $500,000 would be a joint investment in the research required to establish the impact of this intervention on patient health outcomes, on well-being, acceptability, feasibility. While at the same time moving forward with scaling up. So that's their particular interest as a funder, is to initially invest in what they call big, bold ideas. That's where we got the original 100,000 to get this e-module off the ground. Before they will go to $1 million for scale, but before they're prepared to invest the $1 million, you need to be able to demonstrate for them patient health outcomes. And that's what they're willing to consider giving us the $500,000 for.
Thanks, Stephanie. Did I hear correct? So this 2,000 is really 4,000 in a match?
Yes.
Okay, thank you. I also see a great opportunity here for CPA to collaborate on something as global as this. I guess all the language issues are not like non-barriers. Is that correct? Like we're presenting the PTs are in the language of the country, and all that's.
Yes, let me make a few points. One is English definitely is the dominant language. It's reasonable to move this forward in English. Grand Challenges is also very interested in Francophone version. So they're federally funded, and so that's actually one of our angles to go into them with as well. In terms of partnership with CPA, absolutely. I feel like there are a series of no-cost wins at the table with CPA in terms of collaborating on getting the word out, and with WCPT, whose president is here, Emma Stokes. Also at this meeting, we had WCP's lead on their HIV Oncology and Palliative Care Division, Darren Brown from the UK, who's been a great ally and is quite prepared to join forces with us as well in trying to get this out. But one of the pieces we'd also like to do, as much as I'm pitching to physiotherapists today, it's also a tool for rehabilitation more broadly. So working with the CPA and working with WCPT to also reach out to our colleagues at CAOT and WFIT would be a great help.
Well, okay, so Steph, I've always known you as a great leader, but you've blown my mind away again. And if I was actually a true dragon, like I'd pull up in my jet and we'd have the glasses on from yesterday, and we play some tunes and we would just go to Africa, and I think we would definitely have some better leverage. But unfortunately, I don't have that ability. The question I have though, just because I haven't really looked through the app at all, so once you sort of go through this initial stages of doing those workshops, do you envision though a part where with your knowledge base at U of T one day able to do like a telehealth sort of view, or someone struggling with a particular patient, a case, could you sit in your office and still direct care that way? Is that a eventual sort of telehealth communication that could come right out of this particular module that you built?
Yeah, so the question is what's the potential for telehealth and doing some virtual work? And certainly that's a possibility, but it's not our preferred model. Our preferred model is to develop expertise on the ground and to develop South-South-South partnerships. And that's part of why we want to get this off the ground in 3 countries at the same time, because there is expertise on the ground. The leaders in pediatric rehab are in that region. We're following them. And I had this wonderful opportunity this winter to be spending time in these worlds. And one of the great privileges I had was to speak to a 4th-year physiotherapy class at the University of Witwatersrand, which is the big school in Johannesburg. So this is a class of 100 students that were about to graduate. And the faculty who I work with there, they're big HIV leaders. They've been doing some great work because of just the incredible size of the epidemic there. And they invited me in to give a guest talk about HIV. And I said, well, what do I have to say about HIV? And they said, can you please just say it in a fresh way? It's gotten to the point where it's so common that they don't even hear it anymore. So I went in and I clobbered this class, emphasizing to them, you should be the leaders in the world on rehabilitation in the context of HIV. We're talking about South Africa, where 1/4 of the population is HIV positive. And it's going to be, right? Infections continue to arrive. People are getting newly infected every day. And yet more and more people are on treatment, meaning they're going to live longer. There are going to be more people living with HIV, and more people for generations. And so the model that we would like to advance is one where South Africa and Southern Africa and the entire sub-Saharan region are the leaders in this work. And that's about sort of nurturing the expertise there and developing a South-South-South community of practice where we learn from them.
Thanks.
Okay, we'll just allow Stephanie a moment to clear the room, and then ears will start burning, I'm sure. Actually, we'll have the contestants stay out of the room while the deliberation's happening, and then we'll call you in. Yeah. All right. Can we have our contestants escorted in? Okay. Folks, there's room up front if you want to come and have a seat. And what we'll do is I will announce each prize, and I'll ask DHR to speak on behalf of the group as to why, and then we'll make our, and that'll be it. All right. So we'll go with the second prize. The $500 prize is awarded to Maggie Bergeron and Ellie Afif for the Health Swap project. Come on up.
So what we saw here, and I'm hoping you guys saw this, was an extremely well-developed project, an interprofessional project, a project that they monetized well for us. They told us exactly what they were doing, how they were doing it, in what way they were doing it, and we can see this moving forward. We can see, in fact, that they weren't afraid of a little bit of profit, and we'll see how that comes out. From a professional perspective, they looked at privacy. They have that embedded in it. They looked at it going in a small model and built it out through the years. So basically, large impact for a small amount, what we were asking for the physiotherapy community and mostly for our patients. So really good job.
Excellent. Congratulations. Well done.
That was really awesome. Really awesome. Really awesome.
Present that. All right.
Cash
All right.
that check.
Yeah. Very good. There'll be a real one in the mail. All right. Thank you. Okay. And actually, just a little curveball here, but a heck of a nice curveball. Daryl's just told me that because of the quality of the first prize winner, Private Practice Division is going to add another $500 on top of the first prize to the winner. So making $2,500 to the winner, plus the contribution from Pure Care. And our first prize winner this year is Stephanie Nixon with Sub-Saharan Africa Project.
Yeehaw! I'm just about to tell you why we think that Stephanie is the winner as pictures are taken. I do want to look at the other people in the contest. Great job. Great projects. We really, really hope that you go forward and that you're able to do it because it's a very difficult choice. Thank you very much for all your work and for coming here. You probably in the audience know why we went this way, but let's just explain it for the record. For the HIV project, obviously there are multiple partners, which is spectacular. Masses of background already done, so we're building on a good foundation, or they're building on a good foundation. I'm just going to tell you it's mine. The impact, and what we asked for was impact. The impact is monumental, potentially, and already you've had an impact, but it's an impact on humans. It's an impact on physios and physiotherapy, and it's an impact on the money that you're going to get. Us being able to give a little and a little more obviously could roll out into huge financial impact as well, which will go back to the human impact. So you did a fabulous job of background presentation so that we could look at it from a financial perspective, a human perspective, a professional perspective, and an ethical perspective. Awesome. Thank you.
Okay, well, thank you, everyone. That takes care of this year's Auditor's Desk. If you like this format and if you like this event... Oh,
Excuse me one moment.
sorry.
I'm
He
just
still
gonna
thinks he's president.
I'm gonna pass the mic down to Daryl here. I think Daryl's got a bit of an announcement at this end.
Very good. I'd like to also announce that I'll match the $2,000 contribution on behalf of Patterson Medical.
So if I've understood correctly, that's $4,500, which is matched. So you're walking out of here with $9,000. Awesome. Well done. Here we go. Okay, so I was just going to finish off by saying if you like this format, please give us a great rating on your green forms, and we'll keep doing this because physiotherapists are obviously full of fantastic ideas. So enjoy your lunch, meet your exhibitors, maybe say an extra thank you to Daryl while you're down there, and enjoy the rest of your day. Thank you.